In modern ophthalmology, the focal emulsification technique is developed in a detailed fashion. However, despite the latest achievements, carrying out the focal emulsification surgery of the superdense nucleus of the lens remains currently a central problem. With the superdense nucleus of the lens, the time of the surgery can be significantly increased, that can develop into increased characteristics of cumulative disparate energy and aspiration time. Longer time of focal emulsification surgery may be followed by edemas and burns of cornea. In this respect, the improvement of the technology is very important and would allow, accelerate and facilitate intraoperative destruction and enucleation of the lens that would consequentially lead to a decrease of surgery time and the accompanied complications with this procedure. We have improved the focal emulsification needle, which allows a more effective, deeper and quicker penetration to the layers of the lens and the extraction of fragments from the eye. Most frequent used needles for focal emulsification in interped microcoaxial system for infinity focal machines have a following disadvantage. It's a flat surface of longitudinal character on a front part of a needle, which hinders active penetration of the focal needle into the lens, its destruction and removal from an eye. The new needle differs from the regular needles due to the fact its front surface has a flaring along all the ellipse-like contact surfaces and has equal-sided teeth with heights that exceeds the range of oscillation of the needle provided. The improved needle has the following advantages. The possibility of flat-surfaced contact with the surface of the lens is excluded. The needle edge repeats the classical blade, having the geometric form of an instrument used in crushing and cutting, wedge-shaped. The above-mentioned advantages work as a punch. In order to measure the force that is required for needle penetration into the depth of the lens, we conducted an experiment. The purpose of the experiment was to establish the force needed for focal needle permeation into the depths of the lens and to compare the parameters for regular and improved needles. The lens was extracted according to the method of extracapsular cataract extraction and was classified as a 5th degree of density according to the Burrata classification. The lens was placed in a special container and fixed to its bottom with glue. The head of focal emulsifier Infinity was fastened to a special device which had a possibility to lift the container with the lens for 1 mm per 22 seconds. The container with the lens was placed on a weighting scales with an accuracy of 0.1 gram. Upon a contact of focal needle operating in a mode of 100% longitudinal and 100% of the torsional ultrasound, control panel of the weight scale showed the parameters which corresponded to the effort necessary to permeation of focal needle into the depths of the lens. It was found that the effort required for the new needle to permeate into the depth of the lens with a 5th degree of density equals from 60 to 70 grams. When using a standard needle, the effort necessary for permeation into the depths of the lens was from 100 to 110 grams. Therefore, the effort necessary for the new focal needle in order to permeate into the depth of the lens is 1.4 times less comparably to a standard needle. Clinical approbation of the new needle was performed on 20 patients with a superdense nucleus of the lens. In all cases, surgeries proceeded without complications. No postoperative edemas or burns of the cornea were observed. More effective result of surgical procedures was achieved due to the decreased SDE and aspiration time characteristics. As can be seen from above, the new needle for focal emulsification allows effort reduction necessary for the destruction and extraction of the superdense nucleus of the lens, which in turn allowed it to reduce STE and AT characteristics that resulted in a decreased number of postoperative edemas of the cornea.